class to respiratory system. Today we discuss nasal cavity, trachea, and larynx. And next class we discuss the bronchi, lungs, and mediastinum. You know mediastinum? What is this? Mediastinum.
It is the space in the
Yes,
between
mediastinum
the
is space between two lungs.
lungs.
So mediastinum we discuss at the next class. And today we discuss the respiratory system. Digestive system we ending. Yes, finished. Difficult digestive system. No. What more difficult? Muscles or
muscles.
You give me muscles? If we say about respiratory system, система in Latin, система respiratoria, in Russian дыхательная, дышать. The breathing, дышать, дыхание, yes. And where begin the respiratory system? Nose.
Nasal cavity.
In nasal cavity. In nasal cavity, what you know about nasal cavity we discuss. Yes, little. What you can know about nasal cavity? Have concha. This is communicate with the nasopharynx and nasal cavity. What else? What epithelium in nasal cavity? Ciliated epithelium to clean the air. Yes, ciliated epithelium. What else? What is this? Concha nasalis superior, medial, and inferior. Making free meatus. Meatus nasal superior, meatus and inferior. If we say about I take the skull. In the section, yes, we have orange concha nasalis inferior and purple what bone? What bone? Ethmoid bone. So concha nasalis superior and medial is part of ethmoid bone, and concha nasalis inferior, this is independent bone. And between 1, 2, 3, meatus nasal inferior, medius and superior. And when we discuss the skull of nasal, you remember when we discuss the skull, we talk about nasal cavity. Nasal cavity have septum nasal. What bone making septum nasal? Vomer. Vomer and
क्या पूछा? मैंडिबल किसने बोला?
And part of maxilla. Part of maxilla. Vomer, more big part. It's vomer and part of maxilla, making a septum nasal. And we discuss the communications for repetition. What mean repetition? Repetition. Repeat. For repetition. Who remember the communicates with nasal cavity? How nasal cavity communication with oral cavity?
Station 2.
होती
है
with the environment, foramen, piriformis. Like pear shape, guys. Foramen, piriformis. Connecting nasal cavity with the environment. Then we have concha nasalis. Connecting nasal cavity with the nasopharynx. Then we have canalis nasolacrimalis, connecting nasal cavity and orbit, and canalis incisivus. Yes, canalis incisivus. No, should be in this place. Connective oral cavity and nasal cavity. Then we have foramina cribrosa. Foramina cribrosa connecting the nasal cavity and anterior fossa of the skull. Anterior fossa of the skull. And else we have, Juana we say, and foramen sphena palatinum. Foramen sphena palatinum. Connecting superior nasal meatus with the fossa pteryga palatina. When we discuss the skull, all of this we say. So the communicates, revise. Yes, revise. Juanem behind. Foramen piriformis, canalis incisivus, canalis nasolacrimalis, foramina cribrosa, and foramen pteryga palatinum, sphena palatinum. Connecting with fossa pteryga palatinum. It's about communications. So then, if we say about nasal cavity, the nasal cavity communications with the external, with the nostrils. Nostrils, yes, nostrils. Behind we say this is concha, nasal septum we have, behind the bone and in front cartilages. And the nasal cavity have two functions, respiratory function and olfactory function. If we say about respiratory function, this is lower and middle nasal. So this is respiratory function, meatus nasi inferior and media. And meatus nasi superior olfactory function have. Olfactory cells located in this place. In this place begin the cranial nerve number 1. Nervus olfactorius, smelling function have. So the smelling cells located only in meatus nasi superior. Inferior and medial is only respiratory. Passes air then to the pharynx, larynx and lungs. So nasal cavity have two functions, respiratory function and olfactory function. Covered ciliated epithelium, If we say about outsides, have nostrils, and we have external nose. This is a bones that external nose. No, this is external. External. We can say external nose. Nose in Russian. Nose. External nose. Nasmar is smelling. Yes, watering nose. Yes,
watering nose, nasmar.
And external nose. This is a bones that covering the cartilage and then the skin. And if we say about structure, we have radix, dorsum, apex, and we have two ala nasi. And if we say about what bones making external nose, this is nasal bone and little, maybe little lacrimal and maxilla. If you look, external nose making maxilla, nasal bone, maybe little part of ethmoid bone making a nasal nose, external nose. Then, if we say about functions of nasal cavity, this is air purification, warming the air, hydration, have the mucus, and have the epithelium so clean when we infiltrated, clean the air. Then communicates with, and about nasal cavity, we have some sinuses. This is sinus frontalis. Sinuses, this is a free spaces that can, in normal contain the air, and in disease can contain the pus inflammation. So this is frontal sinus. This is sphenoid sinus, and we have the maxillary sinus, how it's called, Raman Takshas, and olfactory. nasal sinuses. We have maxillary, frontal, anterior, and middle cells of ethmoid and sphenoid. And this is maxillary sinus. Now we are going to the maxillary sinus. Frontal sinus, sphenoid sinus, and maxillary sinus. In sinus, the normal containing the air and function making a more how explain? Who know functions of sinuses? Why air should located in the skull? Why air?
It actually purifies the air which we take. If the sinus is not present, we have
I used the translator.
Humidifies
टेम्परेचर रेगुलेशन
Reducing the weight of skull.
No, yes. So explain. Understand? So in normal, in sinuses, we have the air, but sometimes in this place can collect the pus. The high temperature, you can feel the pain on the projection of the sinuses. Yes. And the antibiotic, this is treatment. Antibiotics. Yes. This is treatment of the sinusoid. Inflammation in the sinus, sinusoid in Russian language. About nasal cavity, this is all. You should know the external nose structure. You should know internal nose, what epithelium, sinuses, what function have the and communications. All. Next class I bring the skull and you should show communications. About nasal cavity questions, no. Then next slide, when we breathing, the air passes to nasal cavity, then nasopharynx. Nasopharynx we discuss, yes, and then going to larynx. If we say about skeletopy of larynx, it's located at the level 4 cervical to 6. It's cervical vertebra. If we say about syncope, behind located the pharynx, in front located the thyroid gland. Two sides passes neurovascular bundles. This is about syncope. And if we say thyroid gland, and below the pharynx passes to trachea. And below passes to trachea. If we say about the syncope, skeletopy, gold we will not have. If we say about larynx and about structure of larynx, firstly this is cartilages, then joints, muscles, and only then the tissue. You should know the cartilages. We have a natural cartilage. Cartilage in English, cartilaga in Latin. The first cartilage, cartilaga thyroide, impaired. Yes, thyroid, because in this place passes thyroid gland. Yes. This is thyroid cartilage, this is thyroid cartilage. Cartilaga thyroide. Have two plate, dexter, sinister. Have upper cornu, lower cornu, it's on. Have upper cornu, lower cornu, two plate and upper incisor. So this is correct position, not this. The deep incisor looking up. And we have the angle. The man, it's more sharp. Adam's apple. Яблоко. Yes. So the man, this angle more sharp, woman more flat. Adam's apple. Understand thyroid? And this is correct position about myself. Yes, correct position. If we look to the larynx, this is thyroid cartilage. Incisor, two plate, cornu superior, cornu inferior, and I think this man cartilage. Adam's apple. Yes, because have Adam's apple. Яблоко. And this is man, I think also because have a sharp Adam's apple. Yes, this is all about the thyroid cartilage. Understand correct position. Firstly, Adam's apple in front looking, then you find the notch. Incisura. This notch looking upper. So this is correct position of thyroid cartilage. Next cartilage, cricoid. Cricoid. Because looking like ring. Yes, looking like ring. Yes, it's cartilage. Cricoid. In Russian, the ring перстень. Men's wear перстень. This is a ring with big stones. No, man likes the перстень in Russian. It's called. The correct position you can see have plate and arch. Plate looking behind, arch looking in front. This is correct position. Cartilaga cricoidea, impaired. This is cartilaga cricoidea. This is cartilaga located below upper thyroid cartilage, below cricoid cartilage. Cricoid cartilage. What is this? Who understands? This is hyoid bone. It's not cartilage. No, to show you hyoid bone. This is hyoid bone. So the larynx attached to hyoid bone, like this. This is correct position of larynx. In front, looking thyroid gland, trachea looking below, and upper looking the hyoid bone, because larynx attached like this to hyoid bone. And this is. What is this? How do you think? Not Adam's закон. Epiglottis. Epiglottis. Yes, in pair. Epiglottis. This is.
Okay.
It's separated. The digestive system and respiratory. Yes, close this. And this. Epiglottis. This is about impaired cartilage, but we can have some paired cartilages. We have cartilago arytenoide. Cartilago arytenoide. I'll show you this. So, impaired cartilage this is only epiglottis, thyroid, and cricoid cartilage. Yes, but we have some epiglottis impaired. Maybe I say it impaired. Yes. Then we have cartilago arytenoide. I'll show you. Cartilago arytenoide. Just 1 second. It should locate it. In this place, cartilago arytenoide. We have fold plica, crica, epiglottica. This fold, and in this plica, in this fold, located paired. This is very small, located inside the tissue. Very small, inside the tissue located. Cartilago arytenoide. Cartilago arytenoide, and we have. In the plica epiglottica, we have cartilaga carniculata and cartilaga cuneiforme, very small, located in the thickness of the folds. And about cartilage, this is all. So firstly, this is cartilage, and then muscles and joints. Yes, and today, just I explain you the muscles and joints. Oh, look on this picture. I explain. This is picture. This is in front. This is when person lies. This is anterior. No, front. This is posterior. Fine. This is what cartilage? Thyroid. Adams. This is Adam. Understand? Project the pictures. This is the thyroid cartilage. Yes. This is cricoid. Yes, have ring and have a plate. How we say the ring? No, circle looking in front, plate looking behind. So this is cartilago thyroide. And this is ring, cricoidea. Yes. Cricoidea. And how we say, we have two small cartilaga arytenoidea. One, they looking like triangle. One and two. This is cartilaga arytenoidea. Arytenoidea, small. Cartilaga arytenoidea. We have two joints in the larynx. One joint where connecting the thyroid and cartilage. Articulatio cricotiroidea. Yes, articulatio cricotiroidea. And second, located where this and this. Cartilago cricoarytenoidea. Understand? Cricoarytenoidea. So we have two joints and we have some. Firstly, you should know what function have larynx. Passes the air and produce the voice. So maybe you hear we have a vocal ligament, ligamentum vocale, vocal, ligamentum vocale. This ligament, explain how going this ligament. We have articulatio arytenoidea have two processes, A and B. A and B have two processes. A, this is processus muscularis. It's processus muscularis. It's called muscularis because muscles attach to this place. Processus muscularis. And B, processus vocalis. Vocal process. Processus vocalis. Understand? A, processus muscularis. B, processus vocalis. And vocal ligament passes from the vocal process and then going up to the thyroid cartilage. Yes. And this is ligament. And I see between we have a gap. Rima vocalis. C. C. Rima. Rima. Rima vocalis. Understand how make ligament? Ligament passes from the vocal process of cartilago arytenoidea and then attached to the Adam's apple, you can say, to the thyroid cartilage. And between gap, C, gap, rima vocalis. So the gap can widening and narrowing. So the voice production, narrowing and widening. This is about, and this ligament, ligamentum vocalia, located not in the air, in normal you not see plica vocalia, located in the thickness of the connective tissue in plica, in fold, in plica vocalis. Today I show you plica vocalis. At this moment, understand?
Yes.
How making the vocal ligament. And then, how we say, we have muscles, some of them constrictors muscles. What mean constrictors? Narrowing. Yeah. Then we have dilatators muscles, widening. And we have muscles that change the tension of the vocal ligament. Tension of vocal, understand?
Yes.
Tension of vocal ligament. So if we say about widening dilatator muscles, in Moodle it's writing two. I show you only one. Musculus cricoarytenoidea posterior. Musculus cricoid cartilage, arytenoidea, this muscle. Number one. Musculus cricoarytenoidus. Number one, this and this. Connecting the triangle shape arytenoid cartilage and round cricoid cartilage. This is muscle dilatator. Dilatator. What means dilatator? Dilation. So when muscle is contract, the muscle number A, process of muscularis, passes in this, how explain you, in this side, and gap it's dilatator's
Narrowing.
correct. The process going in these sides and gap it's widening. Dilatator. Understand? Number 1. Musculus crica arytenoidea. Dilatator. The next muscle we have musculus crica arytenoidea. This is posterior. Dilatator. And we have lateral. This is posterior. And this is lateral. Musculus crico arytenoidus lateralis. This muscle constrictor. What means constrictor? Narrowing the gap. Constrictor muscle. Then what else muscles? We have musculus arytenoidus. This is number 3. Musculus arytenoidus, and between two arytenoid cartilage we have musculus arytenoidus obliquus and musculus arytenoidus transversus. And all of these muscles, constrictors muscles, arytenoidus obliquus transversus, musculus arytenoidus, yes, and musculus crica arytenoidus lateralis, constrictors muscles, narrowing muscles. And one muscle, musculus crica arytenoidus posterior, is dilatator. Change the position, widening and narrowing the gap. And then we have the muscles that tangent the vocal ligament. If we look at then two joints and then muscles. On Moodle oil writing, constrictors, dilatators and muscles then change the vocal ligament. We have musculus vocalis and musculus crica-pteroideus. Yes, strange the vocal ligaments. When the vocal ligaments is strange, it's strange. What happened when vocal ligament is strange? Stretch. Yes. What happened? Yes. How? What do you say that?
High pitch voice.
What means high pitch?
Voice gets very high.
No, like this. Yes. If we say about just
The more it's considered, the more bass voice.
Okay. Thank you.
अरे shooting
this is steroid cartilage. This is cricoid cartilage. This is hyoid bone. We have membrana hyotiroidea membrane. Membrana hyotiroidea in this place. Then we have ligamentum cricotiroidea, and this ligament then going up, two sides meeting in middle, and then continue between the vocal process and thyroid gland and making the vocal ligament. So vocal ligament, this is a free ending of musculus cricotiroidus. Understand or not? Between cricoid cartilage and thyroid, we have a ligament. Ligamentum cricotiroidea. And then this ligament passes up, and free edge of this ligament attached to the processus vocalis, then continue to the thyroid cartilage and making a ligamentum vocale, vocal ligament, and between C, rima vocalis, vocal ligament. This is about the structure, like muscles, explain. And now, how muscles looking on the market. This is in front, yes. This is behind. This is behind. Behind, yes. In front, because this is hyoid bone, pterygoid cartilage, cricoid cartilage. This is behind. Musculus arytenoideus obliquus, musculus arytenoideus transversus. Then we have musculus cricoarytenoideus posterior and musculus cricoarytenoideus lateralis. So if imagine where located arytenoid cartilage, this is in this place, arytenoid cartilage. In this place looking the vocal, and this place looking vocal process, in this looking the muscle was process, vertebrus muscularis vocalis. It's about the muscle. About structure, this is all. And if we opening, firstly on the market, laryngeal cavity have three parts: vestibulum laryngeus, then then we have narrowing part glottis, and then cavitas infraglottica. If we say about vestibulum laryngeus, it passes from the entrance to the larynx and ending at the level of the plica vestibularis, vestibule fold. This is vestibule fold, this is vocal fold. Inside vocal fold located the vocal ligament, yes. So this is vestibulum laryngeus, This is glottis, this is cavitas infraglottica. Vestibulum laryngeus located, how we say, between entrance of larynx and plica vestibularis. Then there are narrowing part it's called glottis, above vestibulum ligament, below the vocal ligament located. And if we connecting, how we say, between two plica vocalis, we can see the rima, between rima vocalis, and space between, and on the side wall, and between the folds, depression called ventriculus. This is ventriculus laryngeus, Morgan's, yes, Morgan's sinus. And the space between the vestibule folds too, this is rima vestibule, and rima infraglottis between the two vocal folds. No, two because it's located on the two sides. And cavitas infraglottica passes between the vocal ligament and entrance to the trachea. If we look inside the natural vestibulum laryngeus, located between entrance of laryngeus and plica vestibularis. Then parts glottis, narrowing part glottis. Then cavitas infraglottica. Glottis, if we connecting, this is rima vocalis. Vestibulum, glottis, cavitas infraglottica. Looking like it's writing, it's on the hourglass. Widening, narrowing, widening. Yes, widening, narrowing, and widening. Then what else about larynx? This is all. Larynx, the voice production, and passes the voice production. Then change the rima vocalis, narrowing, widening, and when plica vocalis is strange, it's the function. And trachea is continuation of the larynx. For the sides, it's making from 16 to 18 cartilage semirings, have cartilaga trachealis, and between have annular ligaments, ligamenta annularia trachea, contains the smooth muscles, and inside covering the mucous and ciliated epithelium. No, about trachea only a structure. It's all only passing the air then to the lungs, and then trachea ending on the level of 5th thoracic vertebra were making bifurcation of trachea. When we discuss the esophagus, we say fifth thoracic vertebra, bifurcation of trachea. About larynx, about preparates, more important, know the correct position of this is spheroid cartilage. This is cricoid cartilage, hyoid bone, and epiglottis. Epiglottis. The correct position is this. I don't know why. It's very big problem for students. Correct position of larynx. If we take preparate with the, it should be like this. Okay. Yes, this is tongue. So this is tongue. And when we, for example, how we say tongue, closing the epiglottis to entrance to the larynx. Yes. So in front, thyroid gland, behind trachea, thyroid cartilage. Yes, it's looking. This is about myself. Correct position. This is entrance. Enter in larynx. If we opening, we have vestibulum, then glottis, narrowing. This is glottis, and cavitas infraglottica, and then begin trachea. I will see how looking trachea. This is a ring. Yes, this is a cartilage, and between the annulus, yes, trachea, 16 or 20. Yes, it's like a tube, and then dividing to the two bronchus principalis, dexter, sinister. Yes, and then beginning the lungs. Understand? Yes. For today, this is all. Yes.